say 3, 2, 1, action.
All right, so today we're going to talk about exercise progression. One of the reasons is just so we can maybe streamline and improve the way we kind of do our TheraX with our patients, just making sure we use evidence-based protocols when we have them available, and then just understanding where we kind of increase our weight, where we don't want to increase it, and what to look for. So on your handout, you've got a lot of the objectives and the rationale for today's in-service. So as I mentioned before, just applying evidence-based resistance overload to our strength programs, making sure we properly progress patients with our elastic resistance and understanding the rationale behind what goes on. I have a reference here if you guys are interested, and I'll pass it around, strength band training. And the book basically goes through everything with regards to the rationale behind the resistance, the difference between bands and tubes, and a whole glossary, a whole compendium of exercises that can be used. We also want to make sure that we progress our stability exercises properly, looking for when do you take a patient from a pelvic tilt to a bridge, to a plank, a side plank, what have you, just making sure that we're kind of timing it and sequencing it correctly, what to look for when they're not ready. Trying to manipulate at least 3 variables of the FIT principle. This will probably take you guys back to PT school. The FIT principle, your frequency, intensity, time, and duration, and type, meaning mode of exercise, so that you're looking at, you're always using that variation of intensity as the very last thing that you change, but looking at maybe changing the rest period, or changing the selection of exercises, or changing the sequence in order to progress their program, and then making sure that we're able to kind of compute and program based on the 1 rep max evidence that we have before us, and then being able to apply the NSCA, National Strength and Conditioning Association guidelines, as well as the ACSM guidelines. So with exercise progression, I broke it down today so that we talk about body weight exercises, so that we talk about elastic resistance, free weight exercises, as well as machines. That's it for today. Okay. So first we'll start with definition of exercise progression. I think you guys know it, but it's always good to kind of go back and look at basics and our foundation. So when we look at exercise progression, specifically today we're talking about strength training. We're talking about providing a progressive resistance. The resistance continuously gets a little bit more for the patient so that we apply an overload to the muscle and the patient gets stronger. So we certainly want to adapt the resistance gradually. You're going to adapt this over time based on that patient's performance, their health status, and then as that resistance increases, the reps go down. So once they're able to do, say, 3 sets of 12 at a certain resistance, once that's no longer challenging at those last 3 reps, reps 10, 11, and 12, at the end of that 3rd set, then you're going to increase your weight. Well, when the weight goes up, then the reps go back down to 8, particularly if you're programming for like strength and hypertrophy, strength and endurance. So a double progressive program is where you alternate. That's exactly what it is, alternating the increase in reps with the increase in resistance. Okay, so you want to start with a weight that the person can do at least 8 times, all right? And then once they can hit 12 reps, as I mentioned before, and that's no longer challenging, then that's when you're going to start increasing your resistance again, and then you just flip-flop and you drop the reps back down. Making sure that they can do those 12 reps nice and easy, it's no longer challenging, with proper form, with proper cadence, with proper technique, with proper postural alignment. So all those things kind of have to come together. And then lastly, remember, we're not going to increase that resistance by any more than 10%. So your resistance increase is always right around 5 to 10%. Some sources will say 2.5 to 10%. So the 3 principles of progression, just as a review, are providing a progressive overload, so it's occurring over time in a very sequential fashion. There's method to the madness, making sure that there's variation in the program, whether it's line of pull, whether it's free weight versus body weight, is it weight bearing, non-weight bearing, open chain, closed chain, and then also specificity. We know that training is specific, so if we want someone to do better with going up and down the steps, then obviously you're looking more at strengthening those anti-gravity muscles, working on balance, so making sure that we're actually specifically training them to do what they're interested in being better at doing. So always training towards their goal. So when we look at our body weight exercise progression, I've just given you guys a lot of different ways and ideas that you're probably already aware of, but sometimes we get stuck in a rut and we may not necessarily think about something that's possible. So certainly, you look at gravity eliminated. If someone comes in, they're really painful, they don't have a whole lot of mobility, they don't have a lot of strength, obviously, then you may have to start with gravity eliminated position in order to move forward. Looking at partial weight bearing or supported situations where the person has upper extremity balance, they're holding onto a rail in order to do an exercise. Better to hold onto the rail and do it if they can tolerate some reps of it, as opposed to having them in a gravity eliminated position when they could actually do a little bit more, because then you kind of do them a little bit of an underservice and you undertrain them. Okay? Looking at modified positions, whether you're looking at, say, taking a wall push-up, then going to a table push-up, then doing a modified push-up to the floor, then progressing to push-up with knees extended, then progressing to a push-up on the ball. So you go from your static and weight bearing and you start to take away that support as it's being progressed. And so that's a progression of that exercise there. Looking at full weight bearing without any external supports, looking at all the different tools that we have around to progress their resistance, whether it's a free weight, whether it's adding an inflatable disc for balance, a rotating disc. We don't have one here, but it just looks like two wooden discs with ball bearings in the middle, so it kind of moves, rotates back and forth clockwise and counterclockwise, so that you can also progress their balance and challenge them just a little bit more, especially if they couldn't take more resistance. You just kind of challenge the way you present the resistance, and sometimes they can tolerate that. Varying their base of support. Oftentimes patients are still standing, with feet nice and wide, or maybe even with just feet hip width apart. You might want to bring their feet closer together, narrow the base of support, therefore it's going to require more stability for them to be able to perform that exercise. And when it requires more stability, obviously they're going to start to improve their balance. So it gives them an additional challenge. Even if it's just bicep curls, you can change their base of support and still functionally work on their balance, because they're not always going to have the ability to stand with their feet apart in everyday life. And then looking at an unstable surface, either just going from the floor and then maybe have them stand with one foot on the AirX pad and the other foot on the floor, and then progressing to both feet on the AirX pad, or even standing on a pillow with one foot on. Anything to vary that surface that they're standing on just puts a different overload on their body and adds a different amount of intensity to their exercise. And then also looking at unilateral support, getting more into one leg exercises, making sure they're able to tolerate standing on one leg. When they do stand on one leg, are they still able to maintain their postural alignment as well as their stability? And last, omitting that visual feedback system. So when they have their visual system taken away from them, obviously that exercise is going to be more challenging. When that exercise obviously is more challenging without the visual feedback system, you get a real good sense of how well does that patient internally know that exercise. In Pilates, we talk a lot about an unconscious competence, meaning that your body naturally knows how to perform the exercise. You no longer have to think about it. You've got those muscles that are strong, that keep you in alignment. You don't have to think about bring my shoulder blades down, stand up straight, tuck my chin. It's naturally there, so you're unconsciously competent. And you're looking for that. If you can take away the visual feedback system and they can be unconsciously competent with the performance of their exercises, then you know where they are in time with regards to adding more resistance. It's really good. They're not always going to have a mirror in front of them when they have to go up the steps to know, which foot goes first. Is my foot straight? Is my foot turned? What am I going to do here? So those are all different ways to progress your body weight exercise progression. Now when we look at elastic resistance exercise progression, you have to be real certain about what manufacturer you get your equipment from, because sometimes people think the color coding is universal, and it's not. Different manufacturers use different colors just because they can. So picking up a red band that you might have had from another therapy clinic years ago doesn't always equate to the same red band that's going on here. The same thing with the tubing. If the band and the tubing come from the same manufacturer, chances are you're going to get the same amount of resistance from both. It's just a matter of comfort level with regard to the grip and the handle on the tubing. They make some handles that are soft and are like a canvas webbing. That's a little bit more comfortable, say, for someone with arthritis versus the hard plastic handle. So the tubing and the bands can go hand in hand and be used interchangeably, more so when they're from the same manufacturer. Now, different points you want to keep in mind with elastic resistance. The resistance tends to increase by 20 to 30% with each color. So yellow with the TheraBand, yellow obviously is going to be your least resistance. When you go to red, you're taking a 20 to 30% increase in resistance. So when you're going to progress a patient, you want to know you got 3 sets of 10 completed with the yellow. You know, you've checked your form, you've checked their execution of the exercise. You know, you challenge them in different ways to know that they still have that motor plan and good movement patterns when you progress them to the next color. And if you go back to the first slide, remember we talked about the resistance increase takes place from 5 to 10%. So jumping from 20 to 30%, what you might do instead of jumping from yellow to red is making sure that they have adequately elongated the yellow and taken up all the resistance that that yellow has to offer before you jump to red. So the bands are designed where you stretch them 2 times their length, their resting length. So if they can perform rows, you know, right here with that band in front, you want to make sure that they step all the way back and they've stretched that band twice its resting length, and can they tolerate that resistance in that way. So make sure that you use a resistance that allows the patients to finish the reps with not a lot of excessive fatigue. They can do it with proper postural alignment. You know, as they pull the band back, say for example with a row, they don't let the band snap back, because just like with a free weight exercise, there's still a concentric and an eccentric part to the exercise. So when the band returns, they should be executing control. They should control the band going back, not the band controlling them. You know, it's like who's walking the dog? So you want to make sure that they've got control there, making sure the postural alignment is still there. And then, you know, challenge their base of support, you know, narrow versus wide, 1 foot on an unstable surface versus a stable surface. These are all ways versus just consistently going, okay, you did yellow, okay, let's go to the next one, let's do red. Okay, you did red last time, you got 3 sets 10, okay, now let's go to green. You know, there's a lot of work to be done between the bands, and once you start jumping from one color to the next, note that progression in resistance. Making sure that you know what amount of pounds you're roughly getting with one band versus another band. And I left in the very back of your handout, there's a sheet, and we'll go through this because the slide is popping up, and there's, well, probably not quite so on the back, but in one of the slides, it will show you how many pounds roughly you get with yellow. Like it's about 3 pounds. When you jump to red, it goes to 6. So it might be on one of the slides. I'll show you right next, okay? So remember, the force produced by the band depends on how much you can actually stretch the band. So if they're only stretching it a little bit, and it's a fairly long band, they're really not getting as much resistance. So before you progress to red, you need to make sure that they've stretched that nice long band twice its resting length. If you give them a really short band, then obviously the amount of resistance they're going to get is more, and you're stretching that twice its length, you don't have to go as far. So there is method to the madness. I already mentioned with regard to manufacturer, same color band, same color tube from the same manufacturer, roughly the same amount of resistance. It's a little difficult to accurately quantify exactly how many pounds is each band, because it changes with how much they're able to stretch the band. But make sure that when you choose the volume and you choose the intensity, that you're choosing it to match their goals. You're programming for strength only, you're programming for hypertrophy, are you programming for strength and endurance? Make sure that it matches the goals there. You want to start with the light band first. You know, a guy comes in and he's like 300 pounds, and someone might have assumed that I was crazy, and sometimes you're not too far off the mark in assuming that, but oftentimes when I have a big 300-pound guy starting with a yellow TheraBand, it's because usually I know they're just going to plow through with a really dysfunctional movement pattern to do those rows. They've come in, they've injured, you know that there's an issue there. So chances are they're going to pull with their biceps to stretch that band. And they're going to be using a dysfunctional movement pattern when you're specifically looking for them to engage their mid-traps and their rhomboids. So you start light to make sure they use proper form. You would have completely missed that if you started out with red or green, because then what they're going to do is over-recruit and start to call in other muscles to perform the exercise to overcome the resistance.
Trish, what was your reference for that? I see this, just that little piece out of the book.
Yeah, that was in that book, The Stretch Band, from Todd Ellenbecker, that book right there. And I have the slide popping up.
That's a good book, man.
That's where this came from? That gave the poundage for the various colors?
Mm-hmm.
Oh, okay.
Exactly.
That's a nice book.
So you also want to make sure that you keep the band in the plane of movement, and more so probably in the exercise industry, sometimes you see an inappropriate application of the band. So if I'm going to do a bicep curl with whatever color band you want to do, you want to make sure that the band is going to be opposite that line of pull. So the band actually needs to be in the same plane of movement. So I'm doing elbow flexion, so it needs to be in the sagittal plane. So sometimes I see bands coming out here and they're just off. You know, you want to keep your resistance to 90 degrees, right? So that band needs to be low if you're going to be pulling against gravity to come up, using that example as a bicep curl. And then also making sure that it's parallel to the direction of the muscle fiber. So my bicep muscle fibers are going to come this way, then I want my band to run parallel so that when I pull up, you get the correct application of the resistance. So where you place the band really matters. Many of the patients and the general consumers don't necessarily know it. It looks pretty benign. I mean, can't you just pick it up, just stretch it, right? No. All right, so this is one of the slides. You probably have a tougher time reading it on your handout because it's probably pretty reduced, but it is in the book. And basically, based on the research, they've shown the level of resistance for the TheraBand. So you can see the different colors going on the horizontal axis, your yellow, your red, green, blue, black, silver, and gold. We don't have we have some blue, but we don't have the black, silver, and gold here. All right, so if you look at, if they just elongate it 25%, what's that?
We have the
oh, we
gray.
have a gray, yeah.
Yeah, black. Black.
So if you just elongate it only 25%, just stretching it 25% of that 2 times its resting length, you're only getting 1 pound with the yellow. Okay? Now for some patients that's actually appropriate, okay? But that's what you want to keep in mind. Look at how much they're actually stretching that band. That's going to give you an idea, not super accurate, with regards to how much pounds of force. So then when you transition them from elastic resistance to free weight exercise, you know where you're going. So if you take them off the yellow and they've only been keeping it pretty slack, and they've only been pulling at 25%, and then you go give them a 4-pound dumbbell, that's a huge resistance progression that's more likely to set them up with more delayed onset muscle soreness, possibly increasing that risk for injury. You may see less execution, poor form, poor posture alignment. When you progress, I mean, that's a huge span of progression. So as you can see, as the percent elongation increases, the poundage goes up. So if you go down and you see 200% elongation, twice its resting length, if you do twice the resting length with the yellow TheraBand, you're getting 5 pounds roughly. Okay? So that's fairly helpful, so that way you kind of know what your patient is able to tolerate. Now this is just showing you the same thing in a graph formation. So the dotted lines will show you the yellow, okay? Solid line will show you the green. So what you're noting there, obviously, is just as the percent elongation increases, your pounds goes up as well, okay? So it's basically a linear equation there. Now you can see the force in pounds just in a bar graph. So with yellow, you're roughly getting about 3 pounds, right under 5, okay? When you go with full elongation, and then it gradually increases. Like red will take you right up, like yellow's like 3, red's like 5, green will take you up to 6, and then you start to get larger jumps as you go up in color. So it's also important for the patients to keep in mind when we're discharging them and you're going to send a band home, sometimes send them home with something they can grow with, and just let them know. Start to stretch it out a little bit more as you're doing your exercise programs when you need more resistance. So if they've been working consistently with the yellow, but you kind of feel that they might be progressing beyond it soon, then if they're going to get discharged, give them a red and then only have them do 25% of the elongation. So you keep the red somewhat slack, and then as you get stronger, you start to stretch it a little bit more based on tolerance.
What do you think about if they have a yellow and they just come and step in closer? But that's why I tell some people sometimes just to step in closer and then pull back.
They can step in closer. You also have to look at how much band is left hanging from their hand. So sometimes they step in closer, but then you've got this long tail hanging. So then you've shortened the band, which is going to give them more resistance. Then when they go to pull, they might be pulling at that 200%.
Oh, okay.
You know, so you have to look at the length of the band as well. So yeah, you can definitely step in closer because that's just going to basically decrease the amount of resistance. And then here's also a dosing chart for the resistance exercise. So if your goal is to program the person for strength and power, then you want an intensity of 85 to 90% of their 1 rep max. So then multiple reps, if they're doing more than 1 rep max, you're looking at 3 to 6 reps there. You follow? Then if you want more high intensity endurance and speed, you're talking 70-75% of the 1 rep max. As your percent 1 rep max goes down, then obviously your reps are going to increase, right? Because it's less intense exercise. So theoretically, you should be able to perform more reps. And then with a low intensity endurance, which probably encapsulates a good percent of our patient population, some of them can do a lot more and some of them not so much, then we're looking at 55 to 60% of the 1 rep max, but you're looking at them to be able to do like 20, 25 reps maybe. Now again, you still may be looking at, 3 sets of 10 or 2 sets of 10, so you want them to honestly gauge their activity tolerance. So they know when they need a break, so they just don't plow through thinking that he's standing there, he's watching me, I gotta give him 10 reps. If I don't do 10 reps, I'm not doing a good job. You wanna make sure they understand it doesn't have anything to do with that. So now we'll talk about free weight exercise progressions. And so when you're looking at the free weight exercise progressions, there's a lot of different ways that you can progress the exercise. Obviously you can change the resistance. That's probably the first thing that comes to mind. But you want to make sure that you've addressed other fit variables before you start to just bump them up to the next weight. Look at changing the line of pull. So sometimes you might have seen me do a full range of motion bicep curl, but then I might have someone lie prone and do a bicep curl, because now I've changed that line of pull. You change the way that exercise is presented, it changes the intensity of the exercise for the individual. You can vary the speed. So typically with a concentric, you do 1 to 2 seconds up, 3 to 4 seconds down, we'll cover that. You might do it a little bit faster if you've got a lighter weight. Changing the rest period that you give the person, making sure that you vary the range of motion. Sometimes we have to work with the available range of motion, but just making sure that you started to address some of these other variables before you just always jump straight to an increase in resistance. So how do we determine the 1 rep max? Well, we can predict it. And one way to predict it is based on research. If you assume doing 10 reps equates to 75% of the 1 rep max, as you go up in reps by 2, you go down in the 1 rep max by 5%. So if 10 reps is 75%, then 12 reps is 70%. 14 reps will be 65%. You follow? So you're only going to 1 rep max test, not that we've really had too much opportunity to do that here, but just as information, you're only going to 1 rep max test wherever you have standardized norms. You can't 1 rep max test if you don't have a standardized norm, because you have nothing to compare it to know where they fall based on age and gender. And then you also you can also 1 rep max for core exercises, any multi-joint exercise. Hello. So when we compute the 1 rep max, this is what I was just explaining. 10 reps is roughly 75%. So if 10 reps can be done, 3 sets of 12, or you can do 10 reps and you can be challenged at the last 3 reps, then you can estimate the 1 rep max for any other weight. Okay, so as the reps go down by 2, the intensity goes up by 5% and vice versa. Okay, that's just an easy way to keep it in your head so you don't have to start, doing calculations and doing things when you're, knee deep in the middle of treating a patient. Okay, so therefore 8 reps is 80% of the 1 rep max and 12 reps is 70%. So it's just a sliding scale where you can easily just know right off the top of your head where you're going. Now in the back of your handout, when I lecture for great seminars, Carol Lewis actually has a sheet that I've left for you guys. I think your first handout is the big long sheet. And basically this shows you, based on the evidence, exactly what the 1 rep max comes out to. What we just did was just an estimation. So this one long sheet, you can keep it as a reference point, will show you the number of reps across the horizontal axis, okay, and then going vertically, you can look at the number of pounds, 1 pound, 2 pound, and then look at what it's going to be for 50 or 80%. So you can actually know exactly what you're giving the patient, know exactly how you want to progress them. So and then you can also show them how much progress they've made from starting to finishing. So I've left that for you guys. She actually provides this as a tear-off pad that they sell at great seminars for $12. So I've left you one copy to use as a handout as a source, okay? Now on the opposite side, what you have, which is nice to kind of have, is the 1 rep max progression. So on the right hand side, or to the left side, you see that you can write down just the impaired functional tasks. So this really gives you a good evidence-based kind of sheet. So Mrs. Jones, we started off, these were the functional tasks you had difficulty doing, okay? Here were the weakened muscles. So basically, here's the impaired functional task. Those are the weakened muscles associated with the task. You do an exercise program based off the weakened muscles. Then, to the right of that, you'll see the strength training program. So you can look at what you do on the first treatment, you're going to assess the 1 rep max. Then it gives you what you do on the second treatment, and you see how the progression comes. So you can really do an evidence-based approach with regards to providing that resistance for the patient, making sure that it's appropriate for them based on evidence, and then progressing it based on evidence also, and then you can document and clearly show your numbers as opposed to fair, fair minus, good, made improvement, got stronger, somewhat better, those types of things. And then the next slide, this is, the next slide is actually a copy of a two-part kind of laminated card. It's just a little handy desk reference where it shows you on one side the 1 rep max. It goes all the way across. You see like two little 4x6 cards there. It'll show you the 1 rep max. Underneath, what it has is a strength training program. So basically you could stick it in a chart, okay, and then just go right, it's broken down by muscle group. So you go down to the muscle group. So say you want to work on, the first one is shoulder flexion. So you want to go to shoulder flexion, and then you can move to the next column. You can put down what your test weight was, go to the next column, how many reps they were able to perform at that test rep, then what's their 1 rep max based on the computation, then what percent were they doing, okay, and then their exercise weight. And then over time, you're able to show a progression with that. It's a simple chart. You know, when we have people that are transitioning out to mainstream fitness, it's also nice to be able, if they're going to transition, they're going to work with a trainer or not work with a trainer, and kind of start to progress things on their own. They have their little chart, and they just know, basically you can make it patient friendly and just let them know how much to increase their next weight increment by. So you have those, and now we'll go right back to the slide. So you guys now know how to determine the 1 rep max by predicting it, because we went over that. So you just assume, you never have to memorize this whole thing if you just know, okay, 10 reps is 75%, you just go up and down from there. So I put on your slide in your handout the ACSM strength training guidelines. It's also helpful when we're discharging a patient to let them know, so how many times should I do my exercises, or how many times should I, work on strengthening at the gym. So the frequency, the minimum that ACSM, American College of Sports Medicine, recommends is twice a week. What's recommended is 3 to 4 times a week, okay? 8 to 12 reps. You can get strength gains with 1 set. Usually people can't tolerate the amount of weight that they have to do to get benefit with just 1 set. You got to do quite a bit amount of weight for that. It's not being a higher percent of your 1 rep max. So what you're going to do, it's blocked by the plug here, is you're going to do 1 to 3 sets, 8 to 12 reps, 3 to 4 times a week. Making sure they understand when to rest. You're never going to exercise the same muscle group on consecutive days. So when we look at stability progressions, this is an obsession for me. These aren't in any particular order necessarily, although you are going to certainly start with a stable surface. You're probably going to start more supine than you will prone, depending on the exercise. Then you're going to progress to an unstable surface. So you want to make sure that the person can still give you proper internal core engagement while they're progressing. They can still give you proper postural alignment, and they can execute the exercise properly, consistently. Not just the first 2 reps look really good and then the rest kind of stink. You want them all to be good. Because what happens is when they start to falter, then they're starting to strengthen themselves in a misaligned position, in a faulty movement pattern. So then you're teaching the muscles how to stay strong in a faulty way. And we wouldn't want to do that. So then once you go from an unstable surface, then obviously you can look at an unstable surface with resistance, looking at standing on both extremities, then progress to standing on 1 extremity, eyes open, and then eyes closed. So normally, a lot of people we see have a very difficult time engaging their internal core stabilizers, period. They don't have the breathing together, they don't know how to bring that belly button to spine. I often draw a parallel to, if someone's going to go to the gym and do a bicep curl, some people do, but you don't just kind of go in and just kind of flop your arm up and down, right? You kind of have to tighten that bicep muscle and put some resistance through there. The same thing occurs at the core. It's just that if someone's not actively doing that every day, they're less aware. So if they can't bring their belly button to their spine, they can't do a pelvic tilt properly, because a pelvic tilt is a progression from imprinting. If they can't bring their belly button to their spine, they can't imprint. They can't imprint, they can't pelvic tilt. They can't pelvic tilt, keeping the belly button towards their spine and zipped up. They can't bridge. They can't bridge, then they certainly can't do like a marching bridge. They certainly can't go into side plank right away. They certainly can't go into sideline exercises, because sideline is a progression from supine or prone, where you're completely supported by the surface. All right, so we talked about manipulating those fit principles. changing the intensity, changing the rest period, changing the way the exercises are presented. So I've just kind of encapsulated all that for you. Changing the exercise sequence, typically, you know, we're going to progress from large to small muscle groups as best we can, given the clientele that we're working with, what body part we're working on. You know, typically if you work those smaller muscles first, they're already going to be pre-fatigued before you start doing the larger muscle group. So the amount of resistance they can tolerate is going to be dictated by those smaller muscle groups. Okay? When we look at the speed, as I mentioned before, concentrically typically takes place over 1 to 2 second time frame. Eccentrically is 3 to 4 seconds. So oftentimes people can do something concentrically, but they lack that control eccentrically. They have to show that control on the way down. So in order to prove strength and endurance, you want to make sure you keep the muscles under tension for an appropriate amount of time. When you see the people just kind of rowing and just pulling and rushing through the exercise, they really have not kept that tension on that muscle for enough time to get the strength gains you're looking for. You don't get the strength gains, they don't get the outcomes, you don't get better, and you just end up as a boomerang patient coming back with a lot of different issues. So when we look at the exercise range of motion, obviously full range of motion would be preferred, but we don't always have full range of motion available to us. So obviously, you know, it's usually desired, but there are exceptions to that. Sometimes there's increased risk with using full range of motion. So you want to make sure you use the appropriate range of motion, or sometimes the available range of motion, making sure that we're able to develop strength throughout the range of motion. If you're always doing full, then you start from one at the beginning point, you go all the way to the end, but what happened in the middle? Did you work them in the middle? So if you're starting with hip extension, you start at the beginning, you go all the way back. Well, what kind of happened right in here? So sometimes you can decrease that range to start to work on a little bit of strengthening through that range of motion. Okay? When you look at the intensity, we've gone over this. You know to progress that intensity 5 to 10%. Starting at 5, building up to 10 when appropriate. There will be exceptions where it will not necessarily be 10%, but it might be the next weight increment, say with machines, okay? So you might have to actually, you know, break away from that guideline for a minute. You know that we're alternately increasing the reps with the resistance, making sure that we follow the NSCA guidelines, National Strength and Conditioning Association, and just note that when you overtrain, it may actually require decreasing that stimulus or that overload. You know, you're gonna have to start to decrease that weight a little bit if you're giving someone more than they can show you, demonstrate with proper form and alignment. So I put the NSCA guidelines there on your handout so you have a quick reference. They have 2 rules that they use with National Strength and Conditioning Association. Now granted, National Strength and Conditioning Association, we really look at working with conditioning and athletes, and I have the CSCS certification. But these 2 rules do kind of apply with what we're doing, even though if you're working with a less fit population. The 2 for 2 rule means, and this is how you know when you want to increase that, progress that resistance, okay? If they can do more than 2 reps beyond the goal, say your goal was 10, but now they can do 2 reps beyond that, 12, 13, 14, okay? That's performed in the very last set on 2 consecutive workouts, then you know the resistance is ready to be increased. So if they do, say, 5 pounds, you know, shoulder flexion, just because they come in for the next treatment, you just don't jump to 7 pounds or 8 pounds the next dumbbell. Okay? They need to be able to do 2 reps beyond your goal in the last set, that last set being that 3rd set at least, on 2 consecutive workouts. Then you're going to increase that weight by 2.5 to 10%. Okay? Now, the 2-1-3 rule, this applies to when you're actually going to increase the weight. This is how you do it. You start in the 2nd set first. So they'll do their 1st set at their old weight. Then when they go to the 2nd set, you're going to bump it up. So once they reach their weight resistance, their goal, okay, then you're going to increase the load in the 2nd set first, okay? Then followed by the 1st set, the next time they come in, okay? Then you add that 3rd set. So the next time they come in, you don't just jump to the next weight or whatever and then just have them do all 3 sets at that. So this is a more evidence-based way to kind of apply that resistance. So here are some of the guidelines, because it does change between upper extremity and lower extremity. And I'll give you, the next slide will actually break it down for you. The NSCA has gone one step further and updated these guidelines to show you what to do with a less fit individual versus a more fit individual. So if you're looking at an upper extremity kind of core exercise, you know, a non-small muscle group, you're going to increase you can increase 10 to 20 pounds. If you're looking at a smaller, like your assistance muscles, like your bicep, then you can increase by 5 to 10 pounds, okay? Still using that percent increase. When you look at lower extremity core muscles, it's a 15 to 20 pound increase, but when you look at the accessory muscles for the lower extremity, it's only a 10 to 15 pound increase. Okay, so it just kind of gives you a real quick snapshot of when you do it, how you do it when you're ready to do it, and then how much weight. So when we look at that load increase by guidelines, we can break it down by the weaker athlete and the stronger athlete. So if you have someone who's less conditioned, not as strong as we might like them to be, okay, look at their upper extremity. Now you're going to increase that weight 2.5